Chat. I am Kenji Mono.
I'm Alexis Lomax.
I'm Deanna Williams.
I'm Amber Thomas.
I'm Nafisa Simpson.
And I'm Erica Wallace.
And this is
Girl Chat.
Okay, so today we have for you a really interesting topic, which is about breast cancer. So for most people that don't know what breast cancer is, I'll explain it to you. So breast cancer is a disease in which cells form in the tissue of the breast. So symptoms of breast cancer can be like a lump in the breast, bloody discharge in the nipples, and change in the shape. This all ties to the ACA. The ACA provide a safe place for women that is affected by breast cancer to be able to get insurance. So, for example, if you were to get breast cancer before you had insurance and you find out, the ACA helps create a law that's against any insurance rejecting you from pre-existing condition. So you'll probably get the best insurance and you'll get the best care and will be your risk. And they also provide genetic counseling and genetic testing that can help someone affected by breast cancer. So, Dee, what do you think about all this, like what the ACA provides?
Cost, access, and quality care are the three major cornerstones of our healthcare delivery system. All three have an interactive relationship with one another. The cost of the healthcare, people's ability to get healthcare when needed, and the quality of services delivered. Cost and access is the U.S. main concern. Cost and access go hand in hand with one another. Reducing cost affects the quality of care, and increasing costs affect access to care. There are 9 reasons why our cost is continuously increasing. The first reason is third-party payment. 2 is imperfect market. 3 is the growth of our technology. 4 is the increase in our elderly population. 5, medical model of healthcare delivery. 6, multiplayer system and administrative costs. 7, defensive medicines. 8, waste and abuse. And 9, practice variations. There's also been a problem with the cost contaminant. Cost needs to be controlled because Americans have to forego other goods and services in order to get the medical attention that's needed. And there's also unequal access. The ability to obtain needed, affordable, convenient, acceptable, and effective personal health services in a timely manner. Both low socioeconomic statuses and minority group members are associated with lower healthcare usage and access. Nafisa, how do you feel like this ties along with everything?
Before I begin, let me ask you guys a question. How many of you know someone that's a breast cancer survivor or is currently a breast cancer patient?
I do. I have an aunt who survived breast cancer. She had it twice, and it was removed successfully twice.
That's good. And how was she able to cover her treatment?
She works for the state, so she was able to be covered fully from her job. So she was good on that.
That's good to hear. Unfortunately, everyone is not as lucky as your aunt, and some people cannot afford the treatment for breast cancer. In 2000, the Breast Cancer and Cervical Cancer Prevention and Treatment Act was passed, giving states the option to offer women in the National Breast and Cervical Cancer Early Detection Program access to treatment through Medicaid. All 50 states, including the District of Columbia, chose to provide Medicaid coverage for all women diagnosed with breast cancer through this program. Due to budget limitations, the program cannot screen all low-income and uninsured women. So a number of women are screened at other centers, which means the person may be denied Medicaid coverage. Those women that are not screened through the program, some states have not provided them with the Medicaid for cancer treatment. According to the CDC, there's a percentage of women that once there's a disparity between the black and the white women, where it's saying that black and white women both get annual screenings, but blacks are less likely to start treatment after 30 days of being diagnosed with breast cancer. And this can be for many causes. Maybe they can't afford it, or they're afraid of pursuing with the treatment. Now, when it comes to Medicaid block grants, there's already a limitation as far as the states providing funds for Medicaid for patients that have cancer. If the block grants are passed, then this may decrease the amount of funds set aside for cancer patients, and which will also limit, or patients will have less access to cancer treatment.
Okay, so my topic was cultural competency, and it involves understanding and appropriately responding to the unique combinations of cultural variables. So basically, you learn by like being born into it. So you learn from your country or your culture and your family values or whatever. And then you learn about everyone else's. And it's an ongoing process, so you never really stop learning about it and teaching yourself about it. And it's most commonly diagnosed in women, although men can be diagnosed with breast cancer, but since this is a girls' chat, we're gonna stick to the women. 1 in 8 women will be diagnosed with breast cancer in their lifetime. It is the second leading cause of cancer death among women, and each year it is estimated that over 24,666 women in the U.S. will be diagnosed, and over 40,000 will die. It is more common in the African American community, and that's for the ones who are 45 and under, and they're the ones who are most likely to die from this. A lot of women of color think that if they had a doctor of the same color, that they would have received better service. You have to know how to approach these women. Like some who are older, they like to be called Mrs. or ma'am rather than by their first name. Also, they like to feel like they're a competent person. Some feel as if the doctors may try to dumb things down for them. And when it comes to language barriers, you have to be able to understand and communicate with your patients who don't speak English. And another topic that I want to hit on is HIV and AIDS. They don't go hand in hand, really. So if you had HIV or AIDS, you're not really susceptible to getting breast cancer just because you have that disease. And I'm going to give this over to Erica.
Oh, okay. So speaking of religious beliefs, I want to talk about the Hobby Lobby case versus the ACA. So the Green family, who owns the Hobby Lobby store, their religious beliefs are Christian beliefs, which is they do not believe in any form of abortion. And so under the Patient Protection and Affordable Care Act, employment-based groups, healthcare plans must provide certain types of preventative care, such as FDA-approved contraceptive methods. Exemptions are only allowed for nonprofit organizations. Hobby Lobby, though, is not a nonprofit organization, so they do not qualify for the exemption. So Hobby Lobby basically argued that the requirement violated their First Amendment rights, which is freedom of religion, and they don't feel they should be forced to pay for abortions. The opponents believe that the businesses should not be force their beliefs on their employees, and I totally kind of agree, but then again, I do see the fact about the whole company and their beliefs. They don't want anyone working for them that they have to support something that they don't. How do you all feel about it?
I would have to agree.
I would agree.
Yeah. So it's kind of goes both ways. But in the end, Hobby Lobby won the case, and they did not have to provide contraceptive methods, but they do have to provide state-required minimum essential coverage. And that's what they do have to provide in their health insurance plan for their employees. So in the end, they both kind of got what they wanted in a way, because the ACA does require certain things.
Okay, breast cancer can have a huge impact on someone's mental health. According to CancerNetwork.com, primary treatment for breast cancer, information about the disease from healthcare providers, and making decisions according to the illness can cause major stress, anxiety, and depression. These symptoms can come from cancer-specific concerns, fear of cancer reoccurrence, and worry about doctor visits.
So remember, guys, to get your annual mammograms, if you have Medicaid, it's covered under Medicaid, and most insurances will cover this exam. This has been
Girl Chat.
Girl Chat.
And we will see you guys.
This is that ice cold Michelle fight for that white gold. This one for them hood girls, them